there, Brennan.
Hi, how are you?
Good, how are you, sir?
Can't complain.
Well, I've heard that you're coming in to see me. My name is Sydney. I'm the nurse practitioner here at the clinic. I've heard you've had some issues that you wanted to come in and get checked out. Do you want to tell me a little bit what's been going on, and I can document for some purposes?
Yeah, it was a couple days ago, 3 days ago, I was out in the garage, slipped on some oil and cracked the back of my head.
Okay.
Didn't think nothing of it, but just a dull headache on my right side, hasn't gone away since.
Okay. Did you lose consciousness when you hit your head?
Mm-mm.
Okay. Are you on any blood thinners?
Nope.
Okay. Have you noticed any other issues besides that right-sided headache?
No. I mean, it hurt for a while afterwards, but it went away, but the headache stayed.
Okay. Have you noticed any effect to your vision, anything of that sort?
Mm-mm.
Okay, great. So I'm looking at your health file here. So how you said this has been going on for about 3 days.
Mm-hmm.
Location of your pain is in the right side of your head.
Yep.
Okay. And then characteristics of that headache. Does it feel sharp, like pressure?
It's more dull.
Okay. Okay. Does anything like alleviate it, aggravate it?
I mean, being out and around loud noises makes it worse.
Okay.
But other than that, nothing makes it better.
Okay. All right. So I'm gonna go ahead and ask you some questions too. Have you taken any like Tylenol or aspirin for your headache?
Yeah, just Tylenol.
And nothing has helped.
Mm.
Okay. Have you tried like ice, heat, anything of that sort?
Nope.
Have you ever done this before? Have you ever had a head injury before?
Lots of head injuries, but none that stayed.
Okay. And are you on any current medication?
Mm.
Do you have any allergies to medicine?
Amoxicillin.
Okay. Just amoxicillin or penicillins
Just amoxicillin.
that you've encountered? Okay.
Yeah.
All right. I'm going to go ahead and do a physical exam on you as well. I think that we definitely need to take a look at a neuro exam, okay? And then I have your chart here that I'm going to continue documentation. So I am going to take a look at your chest and lungs. So I can see that you're breathing just fine. Your rate is regular. Chest expansion is symmetrical. You've not noticed any like troubles breathing, anything of that sort?
Mm-mm.
Okay, good. Your chest movement is symmetrical. You're having a use of accessory muscles. I don't hear any audible sounds right now of you breathing. I am going to take a listen to your hair shortly. So I am going to take a listen to your heart sounds. There are 5 heart sounds that I'm going to take a look at. That is aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I will take a look at your anterior and posterior lung fields and take a listen, okay?
All right.
Aortic, pulmonic, and then Erb's point. Okay, and then I'm going to listen to your tricuspid, and then your mitral. Okay, good. Heart sounds sound normal, your rate appears regular, I don't hear any murmurs. I'm going to go ahead and listen to your lung fields as well, okay?
Okay. You want my back?
Good, thank you. You can rotate to the front again. Posteriorly, your lung fields sound clear. No crackles, rails, anything of that sort. No extra breath sounds, which is good. I'm going to listen to you anteriorly, okay?
Okay.
Okay, good. Your anterior lung fields also sound clear. No extra breath sounds, no crackles, no rails, nothing of that sort, which is good. That's a great finding. All right, so I'm going to move on to your more focused assessment here. I'm going to do a neuro exam. I'm going to test your cranial nerves 2 through 12. So with that is your, we're leaving out your olfactory nerve, but we're going to be doing the remaining of it, okay?
Okay.
So we're going to be doing what's called a confrontation exam. I'm going to be covering my eye. You might find this similar to a video that we've done in the past.
Yep.
So we're going to cover the same eye as we're facing each other, and you're going to tell me if you can see the numbers that I'm holding with my hand, okay?
Okay. 3,
to cover your other eye, and we're going to do the same.
4. 3. Can't see it. 1.
Good. Okay, so we're going to move on to your oculomotor cranial nerve. That is going to be your pupil reaction, your field of gaze, and the accommodation, okay? So I'm going to shine my fancy pen light in your eyes here. Good. Your left pupil's brisk reaction, round, reactive. Okay, good. Your right pupil's brisk, reactive, and round. I'm going to say that they measure at about 4 millimeters, which is good, and that is bilaterally. So I'm now going to check your fields of gaze. So with the same light, I'm going to have you follow your 6 cardinal fields of gaze, okay? Don't move your head, just move your eyes. Good, okay. So I'm going to test your accommodation now. I'm going to have you look over my shoulder, stare at an object in the distance. I'm going to move my light closer to your eyes, and I'm going to assess your pupil accommodation, okay?
All right.
Good. All right, so I didn't see any nystagmus. I didn't see anything of abnormal to state in your eye exam. Accommodation was appropriate. Your pupils constricted as they got closer, which is good. That's what we look for. I am then going to move on to your trigeminal nerve. I'm going to have you bite down and open your mouth against my resistance. My hands are going to be at your TMA joint, okay? All right, bite down. Okay, good. Try and open your jaw. Okay, good. All right, now try and open your jaw. Good. All right, so we're going to then move on to your abducens cranial nerve. This is your pupil reaction, fields of gaze, and accommodation. We've already done that within the ocular, motor, and trochlear assessment, which everything was appropriate there. We're then going to move on to your facial nerve. I'm going to have you close your eyes, open your eyes really wide, open your mouth, and then close your mouth and open and puff your cheeks. Good. All right, that's appropriate. I'm then going to move on to the acoustic cranial nerve. I'm going to do a whisper test. So I'm going to have you cover your right ear, and then I'm going to whisper, and you tell me what I've whispered, okay?
Okay.
All right. Pumpkin pie.
Pumpkin pie.
Good. All right, same with the other arm. Okay, are you ready?
Yep. Tattoo.
Good. All right, whisper test was appropriate. You heard all the sounds appropriately. I'm going to now test your cranial nerve 9, which is your glossopharyngeal. I'm going to have you say ah. I'm going to check out your uvula, okay?
Okay.
All right, stick out your tongue. Say ah. Good. I'm not going to physically assess your gag reflex, but I am going to mention for the purpose that you do have a gag reflex. I'm going to have you move on to your vagus cranial nerve. I'm going to ask you to swallow. Good. That nerve is intact. We're going to go ahead and do your spinal accessory cranial nerve. So I'm going to have you rotate your head to your right. Good. And then the same. Good. And then go ahead and shrug your shoulders. Perfect. That was appropriate as well. I'm now going to have you do your hypoglossal. I'm going to have you stick out your tongue, move it up and down, and then side to side. Good. And that was appropriate. I am then going to move on to the musculoskeletal exam. I'm going to ask you to do a series of things, okay?
Okay.
So grab my hands, pull me towards you, push me away, and squeeze as hard as you can. Good. All right. Grips were strong and equal. Grasp and pulls were great, strong and equal. I'm going to have you extend your legs, and then I'm going to have you pull your toes back to your nose. Good. And then press on my hands like gas pedals. Good. Was that difficult for you at all?
Mm-mm.
Okay. I am then going to have you do a range of motion of your upper extremities. So I'm going to have you rotate your shoulders. Good. And then move your elbows in and out. Extend. Good. Okay. You can put your arms up above your head. Put them down. And you can rotate your wrists.
Mm-hmm.
And then the opposite way. And then move your neck. Okay. Great. Any difficulty doing that? Any tenderness anywhere?
Nope.
Okay. All right, and then I'm gonna have you also stand up, and I'm gonna check your gait. So I'm gonna have you stand, and then put your back to me.
Okay.
And I'm going to have you walk normally to the table. Great. Back to me, I'm gonna have you do heel to toe. Great. You can have a seat again. So within the musculoskeletal exam, there was no muscle rigidity, there was no cogwheeling. Within the gait exam, your gait was steady. I didn't see any ataxia, anything of that sort, which is great. How are you feeling after the exam?
About the same.
Okay. Is your headache worse? Any better?
That's, yeah, like I said, the same.
Okay. So I definitely think it would be a good idea to get a CAT scan for you, at least just to take a look and make sure that there's no internal damage. And then we would kind of move from there. My suspicions are that you have a concussion. From your history, it seems like you've had quite a few concussions. Have you ever had a concussion that has had a headache a few days after?
No.
Okay, it is common that you can have a headache after you've suffered like a head injury, especially if you have a concussion. We do diagnose concussions more on like physical exam, and I'm very suspicious that you have one. So with that, we would definitely recommend that you don't watch any TV, don't hold any screens very close to your face. You really don't want to like concentrate and focus on anything. Reading something at a very close distance isn't a good idea. And I think that if we can kind of steer away from those, you may be able to assist your headache, okay?
Awesome.
So I'm gonna go ahead and send you to the outpatient lab to get a CT, and then we can kind of go from there. How does that sound to you?
Sounds good to me.
Alrighty, and you don't have any other, symptoms that you would like to discuss?
Mm-mm.
Alrighty, well, we'll get that working for you, okay?
All right. Sounds
Alrighty, we'll come back with some results, okay?
good. Okay.
Alright, thank you for your time.
Thank you.